Hey guys, welcome back to another video. So today is a Friday and it's currently 7:49 a.m. and I'm on my way to school for our morning lectures. So don't worry, I'll put on my lab coat when I get to school. So let's go. Hey guys, so this is us in school waiting for our morning lectures, which unfortunately did not hold. So after that, we proceeded to the hospital where we had a presentation by our own medical students, my colleagues, on compartment syndrome. That's Dr. Bash, one of the presenters, and that's Dr. Esther, also one of the presenters. So this is the first presenter. I mean, it's just amazing to see how much we have changed over the years. We usually, before, we used to talk about nerves, their innervations, their muscles, and maybe some disease processes, but right now in 500 level we are looking at conditions that patients can actually come with and how you can manage those decisions. So I think it's amazing. So let's take a listen and see what they're presenting. Thank you.
Wherever there is a compartment that is separated by the fascia, so this condition may occur. And then fascia that prevent the muscle from expanding. So when you remove that fascia, when you perform the fasciotomy, then definitely you release the pressure there. Then you remove all external compression also. Then there are other supportive treatment. For example, the patient may come with the renal failure, the patient may the rhabdomyolysis is.
So at the end of the presentation, we had a couple questions from the audience. What is a presentation without a few questions and contributions as also? So it was like we were going back and forth. This person would ask a question and then another person would ask a question and the person would contribute. And we also had a contribution from our moderator. He's going to be speaking in a few minutes and I want you guys to just guess. I'm going to show his face. I'm not going to show his face in the beginning. I just want you guys to guess and then I will show him later.
And also you did mention that one is regarding the management of compartment syndrome. In the case of recurrent compartment syndrome, what is the, like, in terms of chronic compartment syndrome, what are the modalities? What are the treatment modalities? Because most of the modalities you gave us concerning the management is more or less like in acute cases. So I'm talking about in chronic cases, what are the treatment modalities? And also, you did mention that
after 24 hours, in the compartmental syndrome, there is accumulation of free radicals. If you release the compartment syndrome, if you do fasciotomy, you release the radicals into the system, and it will cause maybe shock.
Every time used that it will qualify this thing, what the English. Alright, we call it the perfusion injury. Alright, so after 48 hours, necrosis of the muscles and the nerves have already formed. So once you release, there will be a perfusion injury. So the best thing is to allow this necrotic tissue to scar. Are you getting it? So when there are scarred tissue at that time, there won't be any free radicals. So that scarred tissue will adhere and then it will limit complication. Are you getting it? But once there is a perfusion injury, the next is acidosis, myoglobinuria, acute tubular necrosis. Or that free radicals may just go and shut down the sympathetic nervous system, thereby leading to spinal shock. Are you getting it? So leaving it is another life-saving procedure. So this is the reason.
Okay. Well, I just have a question on that, and then some observations. Based on this part of the story, the first presenter mentioned something about the expensive causes of compartment syndrome, like spleen, cast, and also the determined position. So I would like to get more information or maybe more understanding about how can a cast or spleen or
compensatory position was compartment syndrome. Then,
so if you guessed Dr. Umar M. Abdullahi, you would be right. And if you remember him from my video for our pioneer set when they graduated, you would also be right. So I mean, the love and energy he puts into teaching us, ensuring that we understand these things is just amazing, and I'm really grateful to him for sitting down and putting us through. So let's hear what he has to say. He actually did give us one very key advice for our exams, and I would love you all to listen to it. So let's see.
When there is overly tight, overly tight dressing.
Over a tight dressing. That means he's listening. So yesterday it was what? A skin fraction. Then I mentioned, depending on the degree, it can start from wound, excoriation, and what? Compartment syndrome. That's why if you're in the old rounds, anytime they ask question, you do what? You listen attentively, because that thing is what will save you in the exam. Because on that bandage, on that crepe bandage wound dressing, they can finish the exams there. Are you getting it? That's why medicine, anything is a question. Anything that you're saying is a question. So now, if peradventure they say they are going to do long case, anything, long case and short case, anything is a question. You will finish your presentation, they will finish the exam on splint, cast, and dressing and compartment syndrome. That's all how it will go. Alright? I told you now how my exams went. It's a multiple injured patient, and all these questions of compartment syndrome will come over. Are you getting it? So no more question, right?
So after the presentation, we went, we prayed, we ate, and then we came back to the class. This isn't like on the timetable, but it's a fixed class, so we had to come. Usually after the presentation, after award rounds, we all go home, and that's the end. So 500 level is a little bit less stressful than 400 level, because you have a little bit of control over your time, just a little bit. So this is me getting ready for the class, and then in a little bit you're going to see some of my friends. I don't know if you're going to recognize them. We have Masi, I don't know if you guys recognize him, saying hi to you guys. Yeah. And then beside me we have Khadija. I don't know if you guys remember her from my night lecture in medical school back in preclinical. And then we have Emmanuel. Yeah, so this was the middle of the class. And I think the class ended at around 3:30 p.m. and we all went home. And the topic of discussion was acute respiratory distress syndrome. So thank you all for watching. Don't forget to subscribe, and I'll see you guys in my next video. Bye.